Anthrax is caused by a bacteria known as B. anthracis, a group 1 bacilli. It is a gram-positive, rod-shaped bacteria measuring at about 1 to 4 micrometers that contains an envelope, double-stranded DNA, and a capsule composed of poly-D-glutamic acid. It is often seen as chains resembling boxcars under a microscope. Moving on to the epidemiology of B. anthracis, prevalence and incidence were very difficult to find data for. Anthrax is relatively rare in the United States, so it can only be measured annually at 5 cases a year out of 333.3 million people. Furthermore, we can also look at the annual prevalence worldwide, which is about 2,000 to 5,000 cases out of the worldwide population of 8.1 billion. Although I was unable to calculate a more detailed explanation of incidence and prevalence, these numbers at least emphasize the rarity of this disease. Anthrax is most commonly found in animals. They are primary carriers of this disease. Humans contract this disease in a variety of ways, but you will notice they all trace back to animals. The people who are most susceptible to this disease are those who work closely with animals who may be infected, such as veterinarians, farmers, and people who work in factories processing hides and wool. People who travel to areas where the disease is most prevalent are also at risk. Age and sex are not apparent factors when contracting anthrax. These areas include Sub-Saharan Africa, Central and South America, Central and Southwestern Asia, and Southern and Eastern Europe. These areas are deeply rooted in agriculture, so the dangers of anthrax are much higher. The time at which the spread of this disease flourishes varies by country. However, it has been seen to increase in transmission following prolonged dry spells preceded by heavy rains. B. anthracis has a few very powerful virulence factors that allow it to infect its host and evade its immune system. The first and most well-known is its two plasmids, PX01 and PX02. PX01 is required for synthesis of the anthrax toxin proteins, edema factor, lethal factor, and protective antigen. PX02 carries the genes required for the poly-D-glutamic acid capsule. This capsule protects against phagocytosis as well as consumption by defensive cells of the host's immune system. Another virulence factor possessed by anthracis is the temperature it thrives in. B. anthracis multiplies rapidly at 37 degrees Celsius, which is right around the normal body temperature of humans. This makes us a good host for B. anthracis to infect and thrive within. The third virulence factor is the bicarbonate level in human blood. The induction of the virulence genes of B. anthracis requires transport of bicarbonate into the cell, and the bicarbonate level in the blood of mammals is 15 to 40 micrometers, which plays a significant role in infection. Lastly, B. anthracis contains an S-layer protein that has recently been recognized as a bacterial adhesin, which mediates adherence of vegetative anthrax cells to human tissue. When it comes to etiology and transmission, there are two categories to classify the different methods of transmission. The first category applies when occupation leads to exposure. Non-industrial are occupations such as farmers and vets. Industrial are occupations that deal with the processing of bones, hides, and wool. The main reservoir for B. anthracis is the soil. Transmission starts with the soil and travels to animals and then to humans. Human-to-human transmission is not common. The second way to define transmission is the route by which the disease was acquired. Cutaneous is acquired through a prior lesion when spores enter through the damaged skin. Ingestion anthrax happens when you consume food or water that is contaminated with spores. Inhalation anthrax occurs by breathing in B. anthracis spores. Each type of anthrax has its own location of infection as well as signs and symptoms. All the symptoms listed may start out relatively mild and may worsen in severity over time or without treatment. Cutaneous infections are seen on the hands, head, neck, and forearms. Symptoms can begin with a painless, itchy papule that can worsen and ulcerate, eventually turning into a depressed black eschar, and may develop edema around the lesion. Malaise and headache may also occur. Ingestion anthrax occurs within the oropharyngeal or intestinal tract. Both routes have their own symptoms. Oropharyngeal can cause fever, chills, severe sore throat, trouble swallowing, swelling of the neck, and compromised airway. The intestinal route can cause nausea, vomiting, diarrhea, altered mental status, and possible shock or even death if treatment is ineffective. Lastly, inhalation anthrax infects the lymph nodes of the chest and causes fever, chills, fatigue, cough, shortness of breath, chest pain, nausea, vomiting, and altered mental state. A well-known complication of anthrax is anthrax meningoencephalitis. This can be a result of any one of the three types of anthrax. It develops from the hematogenous spread of the clinical forms of anthrax. Some symptoms to watch out for with this complication are fever, headache, vomiting, and confusion or agitation. It is also often associated with intracranial hemorrhaging. Prevention of transmission can be seen in a few different ways. The first way is by vaccination. This is a 3-dose series of the anthrax vaccination and is usually only received by people who will be traveling to areas where anthrax is more prevalent. This can include military members and people traveling for their occupation. The second way to prevent anthrax infection is by avoiding any animals that may be infected or that live in an area where anthrax is highly prevalent. It is also very important that if you are someone who is interested in animal hides or wool, that you only buy these products that come from animals residing in the United States. This is because not all countries have herd immunity regulations, which can lead to a higher level of anthrax spread. The last way to attempt to prevent the transmission of anthrax is by being cautious about the animal products that you eat. This means knowing where your meat is coming from and ensuring that it is cooked thoroughly before consumption. There are 3 different types of treatment for anthrax. The main treatment is through antibiotics. The 3 most common antibiotics used to treat anthrax are penicillin, ciprofloxacin, and doxycycline. All 3 of these drugs have different mechanisms of action that make them effective. Penicillin interferes with the synthesis of the cell wall during multiplication. Ciprofloxacin inhibits DNA synthesis by preventing DNA gyrase. Lastly, doxycycline inhibits protein synthesis. The second group of drugs used to treat anthrax are antitoxins. These drugs are not given alone, but work alongside the antibiotics. Raxibacumab and obiltozaxibamab both bind to the protective antigen of B. anthracis, preventing it from binding to the cell. The last type of treatment for anthrax is specifically for inhalation anthrax. It is an immune globulin intravenous known as Anthrasil. Similarly to the antitoxin, it is used alongside the administration of antibiotics. It works by neutralizing the anthrax toxin and binds to the protective agent to prevent the protective agent mediated cellular entry of the anthrax lethal factor. There are also some methods to help alleviate or treat symptoms that the patient is experiencing while undergoing treatment. These include IV fluids, oxygen, and vasopressors. Thank you for your attention.